Inshallah ta'ala, we'll be talking about biomedical acupuncture tonight. Um, what I mean by biomedical acupuncture is contemporary acupuncture, not the old traditional Chinese methodology. And we're going to explain what's the difference, in this presentation. So, acupuncture is one discipline extracted from a complex heritage of Chinese medicine, a tradition that also includes moxibustion, massage, tuina therapy, breathing exercises such as qigong, tai chi, cupping, and herbology. Acupuncture is considered one of the camp therapies, and it's included under the energy medicine therapies. As far as the world literature, we're talking about, acupuncture has been used for organic lesions in 40% of patients, and pain problems 25%, surgical analgesia 16%, neurological 10%, substance abuse 5%, and psychiatric problems or mental health problems in 4%. I want to say that there is a school in Europe, using acupuncture for mental health issues. I'm not convinced about it, but I just wanted to let you know they use very sophisticated paradigms to treat mental health problems. I'm not sure that this really works or more or less like placebo. But definitely, acupuncture has a role in acute and chronic pain. We'll start, with the oldest text that really talked about acupuncture, which is the Yellow Emperor Classic of Medicine. It's a beautiful book, and you can actually upload it. Basically, it's a conversation or a dialogue between the emperor and his private doctor. And they really talk about different types of illnesses and how you treat different conditions. It's a beautiful book, even for somebody like us, that learned modern medicine, sort of. Okay, I want to explain this symbol here, the yin and yang. This is a metaphor, and it's really very important to understand that the Chinese acupuncturists, they were actually, when they do their treatment, they want to balance between the yin and yang. But yin and yang is a metaphor. I mean, yin is the dark side, the yang is the light, yang is the sun, yin is the moon, and so forth. And as you can see from this picture, there's no absolutes. So you have yin here, but you have a dot of yang, which actually, um, you know, um, say that there is no absolute yin or absolute yang. So yin creates yang, and yang activates yin. And basically, when we do acupuncture, we try to balance these two forces here. I mean, you can consider something like parasympathetic system and the sympathetic system are like, yin and yang. Okay. And when you do acupuncture, you're trying to balance the sympathetic and the parasympathetic system. Uh, the other concept is the qi or the energy. And according to the Chinese, the qi or the energy moves in a certain channel in your body, very specific channels in your body. And if there's a blockage to these channels, you will develop pain. So when we do acupuncture, we try to, get a smooth flow of qi in your meridians or the channels, or basically deactivate these blockages so the pain can go away. So we'll get into how acupuncture, according to the Chinese tradition, works. Two things that we just mentioned here. Okay, balancing the yin and yang, all right, and getting a smooth flow of qi in your meridians. And the last thing is, deactivating uh, what we call our qi, which basically means the tender points. So the acupuncturist will palpate, find the tender point, put needles there, and this should deactivate the pain. Okay, well, we know that we have an explanation right now for the mechanism of action of acupuncture. And this is the gentleman that, a scientist that found that. His name is Bruce Porminas. And as you see in this picture, um, this is the pain stimulus. Pain stimulus activates C fibers, guys. Okay, while a TENS unit activates A beta. Okay, and the acupuncture needle activates type or A delta or type 3, nerve fibers. So when you do a TENS unit, this will block what we call the gate theory. Okay, and while with the acupuncture, you release chemical mediators in the brain stem, okay, like endorphins, enkephalins, dynorphins, and other mechanisms. So this might explain more here the mechanism of action of acupuncture. It is very kind of sophisticated, but actually these studies were done in animals, which actually, in animals, you cannot get the placebo here. So acupuncture does work on experimental animals. Not only this, we did something called functional MRI, and we found actually that acupuncture works by reducing this yellow coloration, which is basically located in the limbic system. Remember, acupuncture and pain is physical and emotional, right? The emotional aspect is in the limbic system. And through functional MRI, you can detect the effect of these techniques on the brain here. Okay, to understand what acupuncture, you have to understand what TENS unit means. TENS unit actually works through the gate theory. Okay, this is a very fundamental question, and you should be aware about it in pain medicine. While acupuncture sends impulses, sends chemicals to your brain, like endorphins. TENS unit, is well known of a phenomena called the tolerance. Patient will develop tolerance quickly, and that's why you use it only for like 2 hours, and that's about it. You cannot use it the whole day. While acupuncture, there's no tolerance. The gate theory was developed by these two gentlemen, Ronald Melzack and Patrick Wall. And these guys won the Nobel Prize in 1965. Bruce Perminas, in fact, was a student of these two guys. And initially, he wanted to discredit acupuncture. And after as a scientist, he brought it to the lab, he found that no, actually, acupuncture, does something to the patient or the animals that he was using. He was using like a sciatic model. He will ligate the sciatic nerve of different animals, and then he will put different acupuncture needles. Okay, another mechanism of acupuncture is myofascial release. This is very important because there's a very famous lady in pain management. Her name is Jeanette Travell. She was actually the private doctor of JFK. And she said that there is a correlation between acupuncture and the trigger points, or there's like 71% correlation rate. So when you put a needle inside a muscle, you deactivate this muscle spasm and actually will help with the pain. This is Jeanette Ravel, and her book is still the Bible in trigger points on myofascial pain. Now we have the third edition. She actually passed away, in the late 90s, but they're still, editing these textbooks here. You should buy it if you're working in pain medicine. You should buy these books. Anyway, myofascial pains, it looks like this, and beautiful pictures, and you can use it instead of using the acupuncture chart. So there's so much overlap between these. Okay, this is the meridian system, and as you see, a very sophisticated system on the body here. I don't believe in these, things, and I use more contemporary acupuncture that works based on anatomy. Breathing exercises, qigong is part of the whole, culture here. And then you have cupping therapy, and this Mike Phillips, getting cupping here for shoulder pain. Remember, this guy had Marfan syndrome. Massage, or the Chinese call it the Trina therapy. Acupressure is another form of, massage. Acupressure points. You can utilize these. I always teach my patients to utilize acupuncture, and I explain to them the points that are relevant to their problem, and really they love it. So you should learn about acupoints. They're very simple books in the market that you can buy them and you can teach your patients how to do them. Super simple. Top selling herbs, we don't have time to talk about it because we already talked about it in the chem therapies, but the Chinese doesn't the Chinese doctors, or the traditional Chinese doctors, they give herbs as well. Okay, like St. John's wort for depression, for example, or ginkgo or ginger, whatever. Okay, now we're going to compare the traditional with biomedical acupuncture. Biomedical is basically an extension to our, Western or contemporary, medicine here that we learn. We do a regular physical exam, and we diagnose usually by doing X-rays and MRIs and all that, and then the needle insertions are indicated by the physical signs and also anatomically based. While traditional, they have their own exam methodology. They actually, check your face, ask you to stick your tongue out. They do, and then they actually check your pulse and they smell you. They have like a four parts of a physical exam. Of course, it's totally irrelevant to what we know right now, but this is how they treated their patients. The meridians, there is no robust evidence whatsoever that these meridians exist. There might be some overlap in some meridians, like the heart meridian, for example. It actually overlaps with the distribution of chest pain due to heart attack, for example. There is some evidence there. These guys were observers, but it's not scientifically proven. Okay, so according to this, the biomedical acupuncture, uh, uh, you know, the, we choose the points, based on symptomatic points or systemic points that work, all over the body, segmental points that work on certain segments of the body, and using sympathetic and parasympathetic switches. While with traditional, we use the archie, which is basically correspond to symptomatic points. This is the tender points. The meridian system, like we talked about, micro and macro systems that we are going to explain later on, like the ear acupuncture or scalp acupuncture, and then based on the yin and yang. And as I said, Balancing yin and yang is very similar to sympathetic and parasympathetic switches. So there is some overlap between these two systems. Uh, you know, Um, this is the technique of doing an acupuncture. I want to mention that the unit of measurement is the chun, which is CUN, chun. It's pronounced chun. It's the width of the thumb here. Okay. Now, the angle of the needle insertion depends on where you are. So if you're in like the chest wall, you have to do it with an angle, so you don't get pneumothorax, for example. Okay. You can do it with a plastic guide or you can do it without it. Do you see? Like here, he doesn't do it with a plastic guide. Now, if you're really a very well trained acupuncture, probably you're not going to use this plastic guide. But I recommend at the beginning to use the plastic guide so you don't puncture yourself. Okay? It protects you more than it protects the patient. All right, and then you stimulate the needle. You can stimulate the needle with moxibustion, which is basically it looks like a Cuban cigar, and you made of a plant called Artemisia vulgaris. You see, and then you warm up these needles. Or I use this infrared light. I have one of them at my clinic, and actually they're available in Egypt. You can get, buy them pretty cheap stuff. All right, positioning, it depends. Uh, I love this chair here. It's the same like the one they use for massage. Okay, I have it also in my clinic. I ask the patient to sit on it. The patient gets very comfortable, and then I can start my acupuncture session. Okay, now we're gonna talk about different techniques in contemporary acupuncture. I want to say that um, the most important to learn, I put them here. I gathered them from the literature. It took me, by the way, a journey of at least 10 years before I was able to gather this information for you guys. The first technique is developed by Peter Baldry. Peter Baldry was the head of the Acupuncture Society in UK, and I attended one of his courses. He uses superficial dry needling based on Jeanette Ravel, myofascial maps, and he does also guided imagery while he's doing this acupuncture. This is Peter Baldwin. This is the best picture I was able to get from the net here, and this is his beautiful book that all of you guys should, buy it if you want to learn acupuncture. Okay, deep dry needling is the technique of choice for physiotherapists, or what we call them the physical therapists. Okay, and these guys they go very deep inside the muscle, not like Peter Baldwin. Peter Baldwin just go very superficially in the subcutaneous area. But this is the technique of choice for physical therapists, and I use it as well. But I'm just saying, and if you go to a physical therapist, he will use this technique with you. Okay, now there's another technique developed by a guy. His name is Changan, and he does something called intramuscular stimulation. It's a kind of a deep dry needling, but has a certain paradigm. He works mainly at the beginning on the spine because he believes that the spine is the root of all these, problems that you develop in your body. He releases this tightness around your spine, and then he goes and address the trigger point that he thinks is causing the problem. Changan passed away maybe 10 years ago, and he is the one that wrote the chapter of acupuncture in Monica. And this is his, theory that, if you have a shortened muscle, you need to relax it because the shortened muscle can actually, pull on the tendons and cause tendinopathy and can reduce the blood flow. And this way, the toxins will accumulate. Kind of he explains to what he calls it the shortened muscle syndrome. Okay, and he focuses on the one, around the spine, on the sides of the spine. Okay, so shortened muscles can give you edema in your back, and I'm sure if you have a patient with chronic low back pain, you'll see this kind of bumps, in his body here, and this is related to, the reduced blood flow and the edema that happens, related to the shortened muscles. Okay, another technique developed by Joseph Wong, and this guy is a Chinese guy practicing in Canada, but he passed away also recently. He used the meridian system, and he developed his technique based on the old traditional, Chinese method. Um, this is, and he has like almost like 7 or 8 textbooks about, explaining his technique. I use it every once in a while. I have his textbooks, and I use it every once. Okay, so he said, well, you have autonomic switches. He used them all the time, parasympathetic and sympathetic, and he will, use them on top of, using the needles in a special pattern, distal to the pain problem. Western acupuncture developed by Felchi and White. These ladies, they actually from UK, and they developed what we call Western medical acupuncture. And this is a very nice textbook for those of you guys interested in acupuncture. It depends on using what we call segmental therapy. In other words, they will work on the different segments in your body here. Okay, like the paravertebral points, and also they will work on the peripheral acupoints. So let us say here, spleen 10, for example, just to explain to you, spleen 10, is located in L4 distribution. So and you have an L4, radiculopathy. Then they will use this, point that's located on your. Of course, I know these because I've done a lot of these acupuncture, and the anatomy is right now is stuck in my mind. I don't need to think about it, when I do acupuncture. But it needs a lot of, reading until you be able to figure out what to use and what not to use. Okay, these are for the ones for trigeminal. Remember, the trigeminal system is separate from the spinal system. Okay, the trigeminal is for the face. Okay, another methodology by Hu Chi-dong. He's a Korean doctor, and he's an anatomist. And actually, he used to be a professor of anatomy in San Antonio, Texas. And he has a very beautiful book, and I use it all the time. And maybe this is the one that I use most of the time, actually. Right now I don't remember all the names of the acupoints like I used to at the beginning, because I use more or less anatomical methods. Okay, so this guy said, well, I'm gonna biopsy these acupoints, and he found that there are 10, factors that will actually cause an acupoint to be an acupoint. Okay, and then he said the acupoints, is actually phasing. It could be latent or could be passive or active. So passive or active, depending on whether it is tender and pain on and or painful. So an active point is actually tender and painful. The patient will tell you that this is hurting. But with the passive point, the patient will not know it until you push on it. Latent points are the points that have the acupuncture potential. Okay, so they will develop when you get a trauma. These are the latent points. Okay, based on whether they have these 10 factors that I just mentioned a couple of minutes ago. Okay. And he said that this acupoints distribution is actually similar in most of the patients, at least in 85% of patients. They would develop acupoints in their body in a special pattern. And he was able to detect the pain level depending on 2 points here based on the deep radial and saphenous nerves. Okay, and then he classified his acupoints into primary, secondary, tertiary, and non-specific. What does this mean? Primary points are the points that will show up initially, and then the secondary will be the next, and tertiary will be even the next, and so forth. So the primary points, or we call them sometimes the homeostatic points, are the most important points that you need to learn in acupuncture. There are about 24 of them. These are the homeostatic acupoints, and trust me, these are the most important acupoints you need to learn. There's at least 400 acupoints in your body. You're not going to be able to remember these 400 points, but you can remember 24 points for sure. Okay, Bill Craig. Bill Craig is a genius neurologist that developed an electric method for nerve stimulation. He called it pair electric nerve stimulation or PENS. Okay, and it's actually, in fact, it's an acupuncture technique, but he didn't like the terminology acupuncture because he added different frequencies to the acupuncture needles. So this is how it looks like, when you do it. And this is the commonest technique, performed by U.S. doctors, the physicians, not the physical therapists. Physical therapists will do deep dry needling. The doctors will do, Bill Craig method. With and he has certain montages or patterns, or closed circuits, anchor in and out, or cross in and out. He found actually that if you stimulate at low frequencies, you release endorphins, while if you're doing medium frequencies, you release enkephalins. And at high frequencies, you release dynorphins. So he goes from low, medium, and then high, and then he goes back again into low. So 3 sessions each. And he found that this is the best method to get rid of the chronic pain. And usually he starts with 12 sessions. Okay, another technique developed by Felix Mann. And Felix Mann was the head of the acupuncture society in UK. All right. And Felix Mann developed a new technique, never been done before. He developed what we call periosteal acupuncture, where he goes with the needle inside he touches the periosteum of the bone, and he will peck gently on it, and then he will remove the needle. This is a great method, especially in osteoarthritis, guys. But do not do it, in a patient that never had acupuncture needles, because they will actually can develop vasovagal. It's a little bit painful than the rest of the acupuncture techniques. So be careful about this. Okay, and you can use electrical frequency, like Bill Craig, on it. So these are the acupoints that he used in the spine and around the joints, and I do it all the time, in my patients here, and it's actually the most rewarding technique. Okay, I want to talk a little bit about microsystems. So the microsystems are actually, I don't want to call them contemporary. They're actually old techniques that actually been developed to, be a contemporary technique. So in old, as I said, in old methodologies, they used to do what we call pulse diagnosis and tongue diagnosis. Later on, they started to do auricular acupuncture, scalp acupuncture, hand acupuncture, and reflexology. Reflexology is a very old technique, actually developed by the Egyptians. I'm going to show you a nice picture. Okay, so this is the tongue diagnosis. As I told you, the Chinese physician will check the tongue and check the pulse. That's the two main parts of his exam here. Again, each part of the pulse, it tells him different information. I'm not a big believer of either this or that. I just wanted to show it to you because you'll see it all the time, and you got to have an understanding that these are basically a reflection to your whole body here. Okay, this one developed the auricular acupuncture by Paul Nogier from France. Okay, so this is a contemporary method that showed up in the 50s. And as you see, the auricle has a different nerve supply, like the auriculotemporal, lesser occipital, and even the vagus. The vagus nerve doesn't show up in the whole body except in this area, guys. Okay, the superior conchae and inferior conchae here. And that's why they use it for obesity. They put needles here to help with obesity because they found it slows up the gut and it makes you feel full. I've done it enough. I can tell you, it does help. And I wouldn't say in everyone, but at least 50% of patients, will be beneficial. Okay, this is more sophisticated picture for the auricular acupuncture, and you can see the homunculus here, head down, upper extremity up, and so forth. Okay, there's another protocol of auricular acupuncture developed by this guy. His name is Smith in New York, and he used it for addiction. And this one, Dr. Nebzo, used battlefield methods for patients in the battlefield. Scalp acupuncture, again, is a microsystem developed by Yamamoto. This is very useful for rehabilitation, useful for rehab doctors, for like patients with, stroke or cerebral palsy. Hand acupuncture is a Korean technique, and this is one of the most easy and beautiful techniques you can learn. And it's nice because you don't have to undress the patient. And this was developed by the Dr. Tae Woo Yu. And basically, we use it nowadays, tremendously for acupuncture. Okay, so if you go to Korea, they will work on your hand. If you go to Japan, they will probably work on your scalp, and so forth. Each place is different. Reflexology, as I told you, it's an ancient Egyptian technique, which was developed later on, and as you see here, this is reflexology for hand, reflexology for foot. Now, I want to talk about different applications in like acupuncture in anesthesia. You can use acupuncture for preoperative sedation, anxiolysis, and intra and postoperative analgesia, and postoperative nausea and vomiting. I can tell you, it's useful mainly in these three, but this one, it's very difficult to use, guys, because it interferes usually with, the operating theater. And I mean, the patient, it could be very close to the, where they're doing the surgery. And so it's really difficult to utilize it. Okay, for palliative care, we use something called ASAD points, or we talked about in so many instances here, anxiety, stress, and dyspnea points. And then pericardial 6, very important point. There's a robust of evidence behind it, used for chemotherapy-induced nausea and vomiting post-operatively, and for morning sickness for pregnant ladies. Sometimes we do acupuncture for itching, and also it's been shown to be useful in xerostomia, which is a very common complication in palliative care. Acupuncture is not without complications. You can get mild complications, you can get vasovagal, for example, from it. You can get infection or peripheral nerve injury. You can get seizures, unconsciousness. You can even get serious complications like pneumothorax. You can get cardiac tamponade. uh, Remember, there's a hole here inside your sternum. It's present in 5% of the population, called foramen sternale. And if you put a needle there and you don't know that the patient has this little hole there, you can actually cause, cardiac tamponade. Okay, so I don't use this point whatsoever in my agenda here. I don't want to even think about it. It's called CV17, the name of the point. Okay, and you can get different types of, like this here. This is a case report where the needles went inside the patient body. He was an extremely obese patient, and they later on discovered that some of the needles actually disappeared inside his body and was causing him to have severe back pain. All right, now the we're getting very near to the end. I want to mention something called biomedical injection therapies, guys. Biomedical injection therapy. This is a separate a lecture that I'm gonna give next week. Okay, so I cannot go in detail right now about it, but I want to understand that biomedical injection therapy is just an evolution of acupuncture in this century and last century. So instead of just doing needling, we add medications like local anesthetics. For example, we add Botox, we add glucose, we add different things. Okay, we're gonna talk about it next week, inshallah. But I wanted to explain that these guys that are doing biomedical injection therapies actually they learned acupuncture, before they started their new innovations. Okay, key learning points. Traditional Chinese medicine describes special acupuncture or acupressure points. It's a discipline extracted from a complex heritage of Chinese medicine, which include moxibustion, massage, breathing exercises, cupping, and herbology. All right, we're almost done here. This is how it looks like in U.S. Medical acupuncture office, usually very fancy here. This is me doing acupuncture on my mentor. Uh, I found this in Chinese. Z means thank you. Thank you for attending the presentation. If you have any questions, I mean, I think we have like less